Hello, and thank you for joining us to prepare for a week of RLS Advocacy. Today, we are discussing who we are targeting and why. With us today is the RLS Foundation's Washington representative, Philip Goglis II. Thank you for being with us today, Philip.
Thank you, Clara, for having me, and thank you to all of you who will be advocating on behalf of the RLS community in a few short weeks.
Awesome. Can you give us a brief overview of the general structure of the United States government?
Sure thing. So going back to the Schoolhouse Rock days, the U.S. government is broken up into three separate but equal branches of government, where you have the executive branch, which is the president, the administration. They're the ones who enforce the laws. You have the judicial branch, which is the Supreme Court on the federal level and the other federal courts that interpret the laws. And then you have the legislative branch, which is Congress, the House, and the Senate. And they are the ones who create policies, enact laws, and direct specific policies towards different federal agencies. We specifically work with Congress because of their unique role in the lawmaking and policy process.
Awesome. As you mentioned, we will specifically be targeting Congress. Can you tell the viewers more about how Congress is organized?
Sure. So as mentioned, Congress is split into two houses. You have the U.S. House of Representatives and the U.S. Senate. So first, in the U.S. House of Representatives, you have a total of 435 members of the House. Each of those members represents a specific district that is drawn locally by the state, and those members are elected to two-year terms, and the state's members of the House to Congress is determined by their population. So a state like California, which is a large population state, has 53 members of the House of Representatives, while low population states like Delaware, Montana, or the Dakotas only have one member because of their population. Every 10 years, with regard to the census, some of those seats change. States that had a decrease in population might lose a House district, and states that had a large increase in population may get a new House seat. So the House of Representatives has always been referred to the People's House because they run every 2 years, because they represent specific districts with specific interests, as opposed to the Senate. On the House side, you also have key committees that we work with. You have the Appropriations Committee. They're the ones with direct oversight on how much funds get applied to different federal agencies. So that's critically important for us because they determine how much NIH receives in funding, how much the Centers for Disease Control and Prevention receives in funding, as well as some of the other federal agencies with some targeted recommendations as well. You also have the Energy and Commerce Committee, which has jurisdiction over healthcare issues such as opioid policy and other aspects of the health space. And then you have the Ways and Means Committee, which oversees tax policies, but also Medicare and Medicaid policy. Now, for the U.S. Senate, there are 100 U.S. senators, so it doesn't matter if you live in a high population state, again, like California, or one of the Dakotas, Montana, Delaware. Each state has 2 U.S. senators for a total of 100. So those senators are elected over a 6-year term, so that means every 2 years, only a third of the Senate is up for election. In addition, like the House, the Senate does have an Appropriations Committee, which decides how much funding each federal agency receives, along with some specific recommendations. You also have the Health, Education, Labors, and Pension Committee, which is the HELP Committee. It serves as a complement to the House Energy and Commerce Committee. They oversee specific healthcare policy, have oversight over federal agencies. And then you have the Finance Committee, which oversees Medicare, Medicaid policies, as well as tax issues on the Senate side.
Awesome. I know you just mentioned about the committees, but I want to ask you again, why are these committees so important to our advocacy plans?
So they're all critically important because they all have specific functions. The Appropriations Committee, again, decides how much funding the National Institutes of Health receives, which in turn decides how much funding can be dedicated in research dollars to studying RLS and studying different areas that are connected to restless leg syndrome. They also determine for the Centers for Disease Control and Prevention how much is funded at that agency. And for our purposes, we do have a few key priorities at CDC, including the Chronic Disease Education and Awareness Program, as well as the neurological surveillance program as well. So we need Congress to make sure that they understand why these are important programs for our community, so they adequately fund those programs, which are then able to really make a benefit in the lives of our patients and our community. The other related committees on the House and Senate side have strict oversight. So they have the ability to weigh in with CDC, FDA, NIH on any number of policy items, make recommendations for them. And as I briefly mentioned, they also, Energy, Commerce, Ways and Means, Help, and Finance do have specific roles in opioid policy and making sure that the RLS patient voice is heard with those policymakers to ensure that any decision that they make takes into account the effect on our community.
That's super important. We often ask advocates to speak to their members of Congress about the activities of federal agencies like the FDA, CDC, or NIH. Why are these agencies important to the RLS, and how does Congress influence them?
That's another great question. As you mentioned, you have the National Institutes of Health, which is the premier research institute and agency in our country. There's been a lot of focus on them in the past year because of the COVID-19 pandemic. I'm sure many of you have seen Dr. Anthony Fauci, who is the director of one of the Allergy and Infectious Disease Institutes at NIH, a lot in the news. There is a lot of important work that NIH does. They do a lot of the basic science research, and the Restless Leg Syndrome Foundation has been very active with engaging with the leadership of NIH to help them understand the RLS patient perspective, our community perspective, why it's important for them to fund specific research grants and programs that benefit our understanding of RLS. You then have the Centers for Disease Control and Prevention, which focus not on the basic science research like NIH, but on the public education and awareness component. So we are very supportive of robust CDC funding because of the new chronic disease education and awareness program that was created last year that we've been very instrumental in supporting and are supporting again this year, which gives the opportunity for us to engage with CDC to work on education and awareness programs for medical professionals to better understand the signs of restless leg syndrome, some of the treatments of restless leg syndrome, and then for general awareness to the public, for individuals to, again, understand what restless leg syndrome is and to find resources that can help them with their diagnosis or that of a family member. It's important for Congress to hear from us because they do have that specific role of appropriating the funds for these agencies, providing specific recommendations about what they would like to see done, and then general oversight to ensure that they are working towards some of the goals that have been laid out for them. And the only way Congress does those types of things is by hearing from you, their constituents who advocate for specific recommendations that we have provided for everybody.
Awesome. Well, that's it for today. Thank you so much for taking your time to share with us this important information about how Congress works. You can watch more of our virtual advocacy videos on our website at rls.org/advocacy. Thank you so much, Phil.
Thank you, everybody.